Hello, hi everyone. Another day. Very good. Okay, so how are you guys doing today? Good evening, everybody. This is Dr. Radialis from the Georgia office. Like most Tuesdays, I shouldn't say every Tuesday because every now and then, if I am going out of town or there's conflicts, then I might not be able to get online and chat with you guys. But I always try to get online and discuss subjects of interest. So hi, everybody that's joining me. I was yesterday at Syracuse helping out the crowd up there doing retrievals and transfers. So if any of you intersected my path, then I hope that you are blessed with a little bundle of joy or two. So today I didn't pick a particular subject. I thought that we always have some questions, and then I thought of doing a Q&A. I know that I usually will pick a subject, but then some of your questions are not fully answered. So a very common question that I get, and I'm going to start with a question, is how many embryos should I transfer? It's a question that I get asked all the time. I know that we've discussed this before, and everybody has an opinion. So I'm just going to go through layers of the answer. First, I'm going to go through the rules of the game. So the American Society of Reproductive Endocrinologists say that women under 35 should transfer 1 embryo. Women above 35 could transfer 2, up to 3 after 40. However, if the embryo is PGT tested, then it is 1 embryo across the board. My opinion, okay, that is my opinion, is do 1 at a time. I had this discussion probably 4 times last week, and I'm going to play a little devil's advocate here. Why do I recommend 1 at a time? If you're younger, because you have more chances of ending with multiple pregnancy, and multiple pregnancy by itself is increased risk for diabetes, high blood pressure, preeclampsia, complications, preterm labor, and miscarriage. Nobody talks about the miscarriages after transferring 2 embryos, and I think it's very sad, and I don't know, as a woman, I know how devastating that can be, that after all the work you put in and you have your babies and you're 8, 10, 12, 16 weeks and you lose them, it is almost worse than not getting pregnant at all. So I want you to think about those things. More is not better, okay? You're putting 2 to compete for the food and space of 1. And this is not a spontaneous string pregnancy, it's a forced string pregnancy, so makes it even a little more fragile. On the older crowd, the reason that I still recommend 1 is because you have less embryos. So if you're 40 plus, most of the times you end up with 2, 3, if you're lucky, 4 embryos. So each embryo is like a golden token. So you want to give each embryo the opportunity to create a healthy baby. If you use them 2 or 3 at a time, you're going to have to do a lot of egg retrievals. I know this is very debatable. Each doctor has their own opinion, and you have your own opinion. Ultimately, especially if you have some failed transfers, most of the doctors at CNY will okay for you to transfer 2. But food for thought, it's not always necessarily a good thing to do. Okay, so I see a lot of activity. So let's see if we can get to some of your questions today. All right. Well, I'm glad, Casey, that you're excited about your monitoring, and many blessings to you and your fam. Hello from Virginia. Hello. Hi, everyone. Good evening. How do I know what protocol I'm on before my cycle? It depends on your AMH. Now, we are going to a low medium dose, so we're using Letrozole 10. That's our new CNY default, 10 milligrams daily for 5 days with 200 of gonal, and 20 of ACG. That is our default protocol these days for most people. So depending on whether we need to go a little lower if your AMH is either too high or too low, but in general, that's what the default is. If that protocol did not do good for you, then we can explore Menopur. Personally, I think Menopur is a better drug, but it's a lot more expensive, and in most cases, the low-dose HCG works as well. The reason that Menopur might be a little better is that Menopur is actually extracted, and this is going to sound a little strange for some of you, from menopausal women's urine. And they believe that then the LH component of Menopur has all the little variations of all the women. So then when you put it into someone else, those variations might actually help certain women do better, especially women with lower ovarian reserve and 40 plus. But like I was saying, it's a lot more expensive, and the low dose ACG works on 75–80% of people. So that's why we go with the default. I'm very irregular with my cycle. Do I have to have a day one for transfer? Not necessarily. You can come in at any time for a baseline and see where you're at. If when you come for a baseline, your lining is too thick or your hormones are out of whack, we can always do birth control for 2 weeks and bring you back for a new baseline. All right. Can IUI take on the first try with a trigger shot age 26? Yes, absolutely. IUI, or intrauterine insemination, is, I call it super sex. So you guys have an idea of success rate. So you having sex in the bedroom, it's 8 to 10%. IUI goes up to 20, maybe 25%. IVF goes 50%, okay? So IUI can take on the first try, especially if you have more than one follicle that could be making an egg. And, you know, from 8% to 20%, it's a significant leap. Is everything is good with my labs and ultrasound? My follicles are healthy. I'm on Letrozole. Do I have a good chance of having a successful IUI? I'm 31. Yep, absolutely. Like I was saying, IUI does increase the chance of pregnancy. Like I was saying, I call it super sex because you clean the sperm, you take out the not healthy sperm, and then you give them a head start by putting them high up in the uterus. You actually get pregnant when you do it naturally, or IUI, you actually get pregnant in your tubes. So I want you to imagine that this is the tube and this is the ovary, right? So the sperm have to run up and you actually get pregnant about here. So the little fimbria are sucking the egg. You get pregnant here, all right? And it takes 5 to 7 days to go back into the uterus. And that's why, in theory, a blastocyst or a blast embryo is more physiologic. In nature, it takes 5 to 7 days for that embryo to make it back to the uterus, okay? I'm having an IUI with trigger shot. I am a fraternal twin. Fraternal twins is actually a characteristic that is inherited. Somebody that has fraternal twins in the family, you know, could have fraternal twins because it is the tendency to ovulate spontaneously more than one egg. Identical twins is one embryo that's split. So, and that is, it is spontaneous. It has to do with a slight decrease in oxygenation early on in the development that makes that little split. Okay. Why is Cerro recommended? Cerro is a combination of supplements, mostly amino acids, that might increase your natural secretion of human growth hormone. So it is an alternative to actually using Omnitrope or human growth hormone, it will not be as good as the actual hormone itself, because the hormone is hormone replacement. It's like saying that chaste tree, which is it's an herb that is used for helping ovulation and increase natural progesterone, is as good as giving you progesterone exogenously. Okay. So in case of a 22-year-old, Cerro is not going to hurt you, and it might help. All right, so somebody had 1 embryo transfer with 1 embryo, no success. Second embryo transfer, 2 embryos, no success. Unfortunately, IVF is the best technology we have, but it's only a 50% chance of success. The other 50% is unknown factors that have not been discovered yet. And in my book, Divine Intervention, there's so many factors: emotional health, psychological health, are we dealing with chronic inflammation, autoimmunity at the level of the uterus there. So if you had more than 2 embryo transfers that have failed, regardless of the numbers of embryos that you've transferred, it's time to stop and do some digging. So like I was saying, I would do an endometrial biopsy, make sure we're not handling chronic inflammation or infection. Are we dealing with endometriosis, adenomyosis? Are we dealing with the uterus not synchronizing with the embryo? And that's where the ERA comes in, just to make sure that the effect of the progesterone in the uterine lining is adequate. So autoimmune panels, coagulation disorders, genetic testing, all of that should be looked into once we start having failed transfers. All right, ovulation strips. I hate those things, by the way. I used them when I was trying to get pregnant with one of my kids, and it was like, am I ovulating? I mean, it's like, it's so subjective. Oh, is this exactly the same color as the other line? So to me, it's so stressful. I don't know if they've improved them since I had to use them personally. I don't think so. So it's still kind of a guessing game. Pregnancy is hard. Yes, it's a challenge. I do know a few women that love to be pregnant. That was not my experience. I actually hated being pregnant. I love the kid, just hated being pregnant. So I can definitely relate. I have my consultation on the 26th. What can I do? Well, if you have an OBGYN or a family practice doctor that will be willing to give you some orders in terms of doing an AMH, TSH, FSH on day 3, estradiol, your thyroid, so the TSH, prolactin, if they're willing to put an order for a hysterosalpingogram. So some of the testing that you could be doing ahead of time. So when you come in, if you come with your testing, we can jump into creating a protocol for you and getting you into treatment right away. Do I need legal contracts to implant into a surrogate? Okay. That's a very good question, Samantha. Surrogacy. Laws have changed quite a bit. When I was a resident, I did my residency in New York. A surrogate was the legal mother of the embryo. So it was actually an adoption process. Those rules have changed recently, thank God. I would definitely have a legal contract with the surrogate mother and make sure that there are lawyers that specialize on reproductive legal rights. And I would definitely talk to one of them before you move forward with something like that. Is it better to transfer a day 3 embryo fresh or day 5 fresh embryo? It depends. Most people will transfer a day 3 for logistics. Day 3 embryos, even though, like I mentioned early, traditionally, because a blast is a day 5 or beyond and is more physiologic, it was thought to be better. But in reality, day 3 embryos do almost as well as a day 5. So if you're doing a fresh, it's probably better just to do a day 3 because of logistics. That's less days that you have to stay in New York or Colorado. And you can always let the other ones grow if they're looking good. Can Hashimoto's interfere with pregnancy? Absolutely. Hashimoto's is a thyroid condition. It's autoimmune. It presents initially as a hyper, so overactive thyroid. And then as the thyroid starts getting sicker, it goes into hypo. And so, yes, because the first risk factor for autoimmunity in any part of the body is having autoimmunity against another organ. So, and it is believed that some of the causes of infertility are immune related. I mean, you've heard Dr. Kills talk about that. That's why we're so huge into the immune protocols, because we believe that most of the infertility issues are autoimmune. So having one condition pointing in that direction has its good thing, because then you know you have to address autoimmunity throughout the body. So for you, keto is going to be huge. The diet is going to be very important. And then a very aggressive immune protocol while you're trying to get pregnant. All right, I'm currently stimming, and I was wondering if it is okay to continue drinking red raspberry tea. Well, I am very conservative about herbs during stimulation. I love herbs. I'm a naturopath. I use them with my regular patients all the time. However, herbs can have drug-herb interactions, so I would be very, very careful with them. Herbs will try to push your body to be more normal, okay? So there's absolutely nothing normal about IVF. We're trying to hyper-ovulate you. We're trying to manipulate your ovaries to do something specific, and we really don't need any herbs interacting with the medications that we're giving you. You're a Menopur and not a CG? Yep. Like I said, I believe Menopur is a better medication. But it's a lot more expensive, and ACG works very well on, 70-80% of people. Okay. Is an AMH of 5.2 high on a 32-year-old? It's normal. It's a normal AMH for that age. I had a blocked left tube, right open, trying IUI, trigger shot. My chances are low. AMH is low and FSH is 5. It's normal. That's a toughie. With an AMH of 0.58, you could try IUI, but I would definitely go to injectables. You want to make sure that you are creating eggs on the side, that your tube is open, and that you're creating eggs on both sides, even if it's like, 2-3 eggs. Okay. Had a tubal reversal last July, and had my SSG today. Right tube is open. Congratulations. On my first letrozole cycle with trigger, how is trying to conceive with one tube IUI recommended? Like I was saying, letrozole only, I would not do with just one open tube, because you want to make sure that you're ovulating on the side the tube is open. So the only way you can do that is actually with injections. Letrozole is a oral medication that will stimulate egg production, but most of the times it will do it on one ovary. It's actually kind of a natural enhancer, if you want to see it that way. So I would be, especially with only one tube, I would be a lot more aggressive and add some Gonal-F, SSH, or Polystim. I will go to the Georgia location. Would it be the office you're in? Yep, I am. I am the Georgia doctor 95% of the time. Like I said, I do go to Syracuse. I haven't been to Albany in a while, but for the most part, I am at the Georgia location. What is the best fertility cleanse before starting IVF? It depends on how aggressive you want to get. If you want to start getting ready just by cleaning your diet and your overall habits, eliminate toxins like alcohol, excess caffeine, processed foods, sodas, junk, fried food, etc. If you want to get a little bit more aggressive, there's several protocols with herbs to kind of clean your system. I would not encourage any type of detox once you are doing your IVF treatment. Okay. How long after coming off birth control can I start process for egg retrieval? Pretty much immediately. You don't even need a period. You can go from birth control into egg retrieval, stimming if you have a good baseline. What is the best vitamins you recommend to start priming for IVF? I usually have multiple protocols. We have molecular fertility, the prenatal, and the ovarian bloom. The ovarian bloom has ovary, glandular in it, CoQ10, and mixtures of inositol, myocytol, carocytol, those good stuff. And then I do a lot of glandular therapy. For those who talk to me, I have the female endocrine pack, and that supports the entire endocrine system. It has the omega-3 in it. You want to make sure vitamin D, it's in it, that you're taking vitamin D, because everybody's low, and vitamin D is very, very important for ovarian function, for recruitment of follicles, and for maturation of eggs and production of progesterone. Also, men and women, both very important. CoQ10 for men is very good for motility. So the boys should also be taking supplements. Vitamin D, a good prenate, good multivitamin, food base is what I usually recommend. There's a company that I absolutely adore. So I personally use a company Standard Process, but there's a company that you can guys get on Amazon called Ancestral Supplements. And especially for the boys, there's one called Male Optimization, which is really, really good. Okay. For irregular periods, can you explain why Letrozole is the magic pill that regulates periods? So the way Letrozole or Clomid works is by decreasing estrogen. And so you decrease estrogen, you cause a positive feedback to the pituitary, and then you increase your natural FSH and your follicle recruitment. So you're kind of pushing your body to do what it normally should do. And that is why it is the magic pill for irregular periods. Most of the times. 31-year-old, endometriosis and PCOS, ovarian cyst, lost left ovary, both fallopian tubes. How does scar and scar tissue affect IVF? That's a very good question as well. It could cause inflammation. It could also, I've seen where the ovaries are moved, so they're hard to find, they're hard to get to. Normally, ovaries are sitting behind the uterus in the very lower part, so they're pretty easily accessed from the vaginal area. Sometimes after having multiple surgeries, you have to do an abdominal retrieval, which it's doable, but it's not the ideal scenario. In an immune suppression protocol, would you recommend starting prednisone during the follicle stimulation phase? Yep, I would, definitely, because then that would decrease any autoimmunity and at the level of the ovaries and allow the ovaries to work a little better. Brand name versus generic medication. For the most part, generics work very well. That's kind of the menopause versus HCG dilemma. But everybody's different. So some people might need the brand. It's like the thyroid medicine. Some people cannot tolerate generics, so. I'm 36, having IUI, have low AMH on Letrozole. Will my IUI be successful as a younger person? It depends. I mean, it can be. I've seen it happen. And if both of your tubes are open, why not? Okay. Yeah, so some people do well on the Clomid, some people don't. Sometimes adding metformin or going into a strict keto diet might do the trick and tilting the balance in your favor. Okay. Can I lower ACG in the beginning but still doubling? Okay. Aha. Right. Oh, congratulations. 51 at 4 weeks. I love those stories. So ACG, early pregnancies. Let's talk about that. I think that's a great. Hey, hi, Dr. Banerjee. It's a great subject to talk. Okay. One, if you have a positive ACG after a transfer or IUI or any way that you're trying to get pregnant, you got pregnant. Okay, unless you had an ACG booster, but most of the times that will be out of your system, and by the time that we check, you got pregnant. So a biochemical is a pregnancy that is lost very early on. Okay, now we can't get super stuck on the numbers. The numbers are just a reference, right? But I like to see them, I like to watch them. The pregnancy will declare itself. So just watch it. Nothing is going to happen if you just let it declare itself. We get stuck on, certain numbers and they needs to double. It does not need to double. Also, especially after transferring more than one embryo, I've seen it where, the number is really high, then it kind of lingers and then it starts going up. So if you lost one of the embryos, sometimes there's that little back and forth in the ACG. So I like to kind of follow it with levels and ultrasound and see it, as it progresses. Okay, and also I've seen very high ACGs with one baby, and also I've seen very low ACGs that are kind of gradually going up, and 2-3 weeks afterwards we have a great embryo with a heartbeat. Okay. All right. Well, hello for everybody. Hi, Gabrielle. Nice to meet you too. All right. My AMH is 8.32. I have PCOS and turning 40 in June. The 40s are the new 30s. So, you're great. I mean, it's having an AMH of 8.3 at 40 does go with having PCOS, and you should be successful. PCOS is a little tricky. Most people are terrified of PCOS and not going too aggressive. And in my experience, I've seen PCOS land in two groups. The ones that everybody's scared of is actually the larger number, the ones that stimulate really fast. They're higher risk of hyperstimulation ovarian syndrome. And also you have to be gentle, because then they make a lot of eggs, but then they're not very mature. So that's the majority. But then we do have a subgroup that is like very resistant, and you have to treat them a lot more aggressively. So it depends on what your story has been, how did you respond with oral medication and so forth in order to create a protocol. But you're in a good place. You should be successful unless there's something else. There's so many factors, but all right. Can you type the med list that our current OBGYN can order before the consults? Well, your regular OBGYN cannot, or they cannot prescribe the medication, but they can do the testing, and they should be able to do the testing for thyroid, ovarian reserve, order a hysterosalpingogram, order a semen analysis, those things. All right. So somebody here had a failed FET with a PGS tested normal embryo that failed. Thank you for that question, because we actually had this discussion, Dr. Corley and I, and a patient yesterday. PGT testing, right, in all of its forms, it's the best technology that we have to test the embryos. However, it's not perfect. It's not perfect in many layers. Like she was saying, a normal tested embryo does not guarantee a pregnancy. And a mosaic embryo does not guarantee an abnormal pregnancy. Okay, so a lot of babies do come out of mosaics because you are taking a biopsy of the outer layer of the embryo, and that could be placental tissue, you know, and then the embryo inside is completely normal. So it's not that clear if it's beneficial or not. There's also debate about what is the effect of the biopsy on the embryo as well. Okay. So food for thought. I know that some of you guys have distinct issues. Like, one, if you want gender selection, I understand. Two, if you know that you're a carrier for a genetic disorder, absolutely, because it's really, really good. But for like screening, it's kind of, I don't know. Me as a woman, I would not invest the $4,000-$5,000 it costs. All right, ladies and gentlemen. Tons and tons and tons and tons of questions. All right, so kind of time's up. If I didn't get to your question, you're welcome to send it to me and reach out to me. I do have a Facebook page for the patients. So you can send me a question if you want to talk to me, get on my schedule. I'll make sure that I will pass on the information to the front desk. Now, if you're trying to get an appointment for monitoring, or it's day one of your period, I would encourage you to call CNY directly, okay? Because sometimes I'm not always around. I was getting a lot of texts yesterday about people needing refills, or people, you know, needing to, it's like, oh, it's day one, put me on the schedule. For that, unless you have a problem, try to call the offices, because it makes it a lot easier for you and everybody else. Okay, but if you have medical questions, you have any challenges, absolutely, you can reach out to me. Okay, so may you all be very, very blessed. The Spanish crowd, I'll see you on Sunday at 8 p.m. And I'll see you all next Tuesday at 9-ish. Okay, have an amazing rest of your week. Bye-bye.